I'm going to show a patellofemoral loop technique. So this can be used for issues with patellofemoral joint where there may be a lateral tracking of the patella or even fat pad issues. Here it works on the basis that the vastus medialis obliquus is delayed in firing, inhibited or weak with a relatively tight lateral structure such as the lateral vastus lateralis and the IT bands. Which potentially causes lateral tracking of the patella. For this method, we are going to kind of loop around the patella. We use a 3-inch tape. We need to cut in the middle all the way up and make sure that we cut all the way through with an anchor of 4 fingers. So this is to make sure that if we can angle around the patella in a better way. If not, it's going to be difficult cornering the area. Now, so what we're going to do is we're going to start on the vastus medialis. We run it along the vastus medialis or even as far as the adductus, so that we create two strips. One, a medial strip, which will cover around the medial part of the patella, and which will also help offload the fat pad, and the other strip will go on to the patella, creating a kind of sling here, as like a slingshot, where when the knee bends, the forces from the tape will resist any kind of lateral movement of the patella. All right, so we're going to tear the edges so that it doesn't get tangled up, and make sure we don't touch the adhesive as far as possible. Right now we need to start the anchor a bit further away from the knee, so that we get enough angling to sweep around the patella. If we start too close, the lever arm might be shortened and also will reduce the offloading on the fat pads, and also it will be difficult in angling the corners. So we're going to start a way up. So I'm going to stick there. Right. We're going to hold on to it to start the adhesive for 30 seconds. Alright, now we have 2 strips. The medial strip is going to come on the medial side. We need to make sure that the medial strip does not contact on the patella. This is to make sure that the force of the tape doesn't pushes it laterally, right? So yep. So to make sure we angle it properly, we are going to give a medial glide so that we know that it's not going to contact the medial patella, and we can use the other finger to hold on to the ankle, and we give a medial glide and sweep around and finish it off in the middle. Right. So now we know that it's not contacting the patella, and the pull here is going to offload the fat pad around this here. Now the lateral strip is going to contact the patella on the lateral edge of the patella. So this will act like a slingshot here. So in order to do this, we need to make sure we feel for the lateral edge of the patella, which is here. Okay, we give the medial glide and make sure it's right. We need to make sure it's contained within the tape, right? And So now this thing will act like a slingshot once the knee is bent. So try to contract the quadriceps. Yep. So when it goes there, this will kind of give a force in medial direction, right? So can you bend? Yep. Okay. So can I get you to squat or do a single leg now? Squat. Yep. How do you feel?
I feel better.
Yeah, better. All right. Now do a single leg squat. Okay. Better than before. Yeah. All right. So that's the patellofemoral loop technique. Thank you.